time of the year where I'm reminded how lucky I am to work with young students, and luckier still to work with young innovators, because it's the innovators that inspire and change the world. From the Steve Jobs to Sam and Saira, who are going to give you their innovations tonight. And it's a time of the year where we take stock, and I love this meeting. And normally it's in the bubble in Imperial, where the innovation hub is. And now, unfortunately, all of us are in our own home bubbles. But if one looks at it, that's where innovation starts. It's a thought, it's an idea, and then it's a creation, and then an implementation. And many people have ideas in the world, many, every day, millions of examples of ideas in the world, but they're not many that actually implement them and deliver them. And so we're going to give you some examples tonight of those that have succeeded, and particularly young innovators. I'm, of course, an old innovator, but I'm going to give you my story, which inspired me to work with Imperial to help and encourage others to innovate. So if we could have my slides, I will tell you my story about innovation and then hand you on to young innovators who I hope will really inspire you, because they're doing it as we speak. Nikita, would we have my slides? Oh,
sure, I'll get them up. Can you see that?
Yes, right. So my name is Julia Riley, and I'm a consultant in palliative care at the Royal Marsden and Royal Brompton Hospitals, and I work at the Institute of Global Health Innovation. And my innovation was to put patients in control, which one would think, oh my God, isn't that obvious? But most innovations are obvious if you look at them. Next. Next slide. So my innovation starts with a story of my sister-in-law, who was 32 at the time, and she had a terminally ill melanoma with metastatic spread to her brain, and she was in awful pain at many times of the day or night. And she had one plan from her GP, and she had one plan from the hospital, and one plan from the hospice, and one plan from the district nurses. And at 2 a.m. in the morning, when my brother was desperate, he would phone the emergency services, and nobody had a clue who she was. And they'd send out a doctor or a nurse, and they'd say she's on too high doses to do this, that, and the next thing. And sadly, very sadly, they would either not give her the medication she needed or send her to hospital. And so when she died, I thought, you know, why can't we just have a single plan per person? And so we started in south of the Thames in London, and we got a paper plan, and it took 18 months to get a data set that everybody in palliative care agreed to. And then a few years later, we went north of the Thames and had the same paper version and the same data set. And then we linked them to the urgent care services by faxing. In those days, you young probably don't even remember a fax, but we would fax them to the out-of-hours GP, to the NHS Direct, which was the predecessor to 111, and we would fax them to the ambulance service and the emergency departments. Problem is, the next day they'd be out of date. So this is the service we've now set up. Patient and family go online. They fill in an online questionnaire called MyCMC, and then they've populated with all their wishes, their preferences, what they like about their health, what they want, and their wishes in terms of cultural wishes, maybe spiritual wishes, maybe who to contact in an emergency, their disabilities or not, and everything giving a picture about the patient. The patient then submits the plan to the doctor or nurse. The default is always to the GP. The clinician adds the clinical details, approves the plan, and it's live for all the urgent care services to see. And so now what do we get across London? We get very good data for populational health. We get good data to see how the urgent care services are caring for these patients. And remember, we don't have 24/7 with GPs anymore. So the out-of-hours services are looking after these patients. It's enabling patients to stay at home. Only 20% die in hospital if they have a plan, whereas nationwide, 47% die in hospital. And we know most people do not want to die in hospital. So we get better care and we get less cost. Next one. So it's a co-created plan and it's shared, and then we get good outcomes. Next one. Next one. This is what it looks like. You have your little tiles and you fill them all in online. Next one. The patient is guided through their questionnaire with little videos that tells them about resuscitation, explains organ donation, and explains very difficult concepts. So we're also able to do what many doctors find very uncomfortable doing, talking about dying, talking about resuscitation, talking about organ donation. And we've got the world leaders who do this every day to do little videos for us and plug them in. Next one. And so then it goes off, and as soon as it goes off, the GP is notified and the GP knows there is a plan waiting for them to complete. Next one. They get a summary of what the patient has said. And for example, if the patient said they have no disability and the GP knows they are profoundly deaf, that's very important to the urgent care services. And so the GP can change it and then auto-populate it into the plan. And the reason we've got the patient's version and the clinical version is the patient's version is on the web, so the security is, as you know, for the World Wide Web, but the clinical record is a very, very secure, safe clinical record that comes with clinical record standards. So the security around each is very different. Next one. This is what it looks like. And so once it goes live, you'll see an urgent care summary, which is what the paramedics open in the ambulance, the 111 doctors open in their vehicles, all the clinical service desks in all the urgent care services open and see the summary. And then if they want further details, they drill down on the left-hand side and they can get further details. Next one. The patient is also connected, so the patient has exactly the same on their mobile devices. So everybody from the patient through to the urgent care services into emergency departments and into the hospital, they all have the same plan. Next one, please. So essentially what we've done is we put the patient in the middle, which is a paradigm shift from paternalistic medical model of the GP being in charge and the GP knowing everything about the patient. So the patient is in control. All the blue ones, the GPs, the hospitals, the communities, are the creators of the plan, who are in blue, and then the viewers of the plan who don't create plans because they don't know these patients, but now they view the patients, so at 2 a.m. in the morning, these patients are no longer strangers to them. So that includes 111, the ambulance, out-of-hours GP, and the urgent care services. Next one. So now we start to see we've got 117,000. We've actually just got 120,000 new patients with plans. And you can see each year, year on year, each color, they go up. Obviously, during COVID, we've had more people wanting to create plans. But you'll find in an innovation, particularly in health, they say, and I don't want to depress you all, that to really innovate into the health service in the NHS takes 20 years. Oh my God, I'll be dead myself with a plan by the time it is. But at least every year I see the numbers are going up. Next one. And the number of times the urgent care services are opening and accessing the plans. And this has been training, teaching, so everybody's connected in. So you can see these are the number of views, and we get about 8,000 views a month now of these plans by the urgent care services. Next one. And very interesting, these are the ones that are viewed by the urgent care services just before a patient dies. And you can see how many patients' records are opened just before they die. Patients, the last year of life accounts for 1/3 of the NHS budget. And you can see how the urgent care services contributed to caring for these patients. It's very, very important that we connect them all up so we all know what their wishes are and how the individual patients want to be looked after. Next slide. And overall, whether we've had one patient or 120,000 patients going through, the hospital death rate varies from 21% up or down by 0.5%. And it's stayed like that. And so what we've managed to do by connecting everybody else is put the patient in charge, make them choose what they want, deliver the care outside of hospital, which is what they want, and thus avoid unnecessary hospital admissions. So the patient gets what they want, they're not going to hospital, the costs are reduced, the care is delivered according to the plan in their own homes. Next slide. And so essentially we start in the home and we end in the home, and patients can die in their own homes. And it's all about what we've done is we've changed a model where the GP acted 24/7 to a patient-centered digital model where the patient's at the middle and all the multidisciplinary services are around it. And it's been done digitally. It cannot be done any other way. So when you think of palliative care, you don't really think of digital, but we hope that each individual gets their own plan and dies in the way they choose. So if you want to know anything more about the service, that's Coordinate My Care, and you've all got my email address. So if you want any help personally, you know you can call me anytime. Now, I will monitor the chat box now. So if questions come in, I will have a look at them. And we'll now go on to a young innovator, Sam Tukra. And Sam's third eye is an extraordinary innovation. And he was the winner last year. So I think it'll be wonderful for you to hear and see what we're looking at and how delighted we are to have him present tonight. Thank you, Sam.
Thanks a lot.
Sorry, Sam, just before you go, could I ask that you all turn off your videos and your microphones because we're recording and it brings in a lot of interference. Thank you very much. Okay, Sam.
Yeah. So you should be able to see my screen. I'll just put it in slideshow. Can I just get a confirmation that you are able to see my screen?
Yeah, that's
awesome. Well, thank you very much for the introduction. So to give you a brief intro about Third Eye, we create an early warning system for organ failure prediction using AI. And whilst founding Third Eye, I'm also a PhD student at Imperial College. And the topic of what I'm going to be discussing is how do we juggle between being a student and, well, raising a venture from ground up. So full disclaimer, what I'm about to discuss is what I've learned from my own personal journey. But the reality is that there is no secret formula or right answer. It's your own journey that you have to make, and it's your own work that you have to essentially flourish. So just have at it is the overall comment I can have. But what I'll discuss is the 4 key things I learned from my journey, and I'll discuss how they're interconnected with my own story. So the first thing, hunger. And this isn't to do with the food that you're after, or a burger, but more like what drives you to create your idea or your venture, because you don't do it because you're looking for a drive. You do it because you're already driven. And the truth is that when you're doing both venture and studies, it will be difficult. And you will go through times where it will become chaotic, and it is your hunger, how badly you want this to succeed or how badly you want to grow. That is what will keep you pushing. It's the endless renewable fuel that you can use to push yourself to go above and beyond. And for me, it was a problem I want to solve. So essentially what you want to do is try to internally understand and solidify the reasoning behind that hunger. And the way you can do that is to question what problem you're trying to solve and why you feel connected to it. In my case, it was solving the odds that are stacked against a patient in the ICU after my own family member being in the position. And I decided I no longer want to be helpless and just wait for this to happen again. So that's what drives me. And you essentially need to solidify that for your own problem that you're trying to solve with your own venture. Second is balance. Now, for people that will be balancing between leisure and work, but if you're trying to juggle two things, then it's basically balancing between your education life and your venture life, both being work. But there are 128 hours in a week, so you can find time for leisure. So the first thing I would recommend is if you're doing a venture, you need to find your flow. There are multiple books that are out there for time management that will recommend you different ways to compartmentalize your workflow. But in reality, you just got to find what is right for you. And the way you do that is, number one, do your venture that is actually closely related to your studies or your skills, or something that you can provide as an advantage in just a flip of a switch or click of a button. That is a no-brainer, because if you can do something that is very related, then swapping your work between your PhD and your venture life becomes very easy. And what you learn from one can be transferred to the other. So it barely feels like doing additional work. It's just a continuation in your journey for growth. Second is within this time management. Now, with regards to balancing my time, I initially started, I can do it half and half, where I do part of my PhD work and part of my venture work. But when I actually really delineated what I was doing, in reality, it was a total mismatch of a bit of everything. And there are thousands of reasons why this happens. A, because of your own curiosity. B, because you love both. Right? You love what you do. And whenever you have ideas forming in one area, you want to bring it to the other, and vice versa. So for me personally, what really worked well was, instead of looking at how I'm going to manage my tasks in a day, I decided to manage my week. And what I decided was a system that throughout the days of the week, there will be some days where I'll focus more on the venture, and some days I'll focus more on the PhD. And I would change this every alternating week. So for example, in this case, I have 4 days dedicated to venture and 3 days to PhD. In a different week, it will be 4 days PhD and 3 days venture. And what that enabled me to do was it brought some more order into my chaotic day by actually making my day appear something like this. And again, vice versa for when focusing more on the PhD and the venture. And the truth is, there is order in chaos. And it is possible, but like I said before, you got to find your flow, what works for you. And my only other tool I use for time management is a notepad. And in particular, I use them for writing tasks that I needed to do, to prioritize them, and, well, essentially remembering to do them in the first place. But yeah, you got to find your flow and create your internal deadlines to enable achieving them. My third point is to let your supervisor know, not only because they can help you, but also if you're taking this forward, it's a professional courtesy, because it is their right to know that they are giving you their time and their resources as well. But plus, you could also be bound, especially if you're doing PhD, to some contractual agreements based on who's funding you. So it's important to clarify that you're not infringing upon any of those rules and regulations. But in addition to that, they can actually help you understand how to get that flow or to grow the business, because you're in one of the best universities in the world with some of the best mentors that are at the top of their game. utilize that, right? Use that to your advantage. Their experiences, their knowledge, their mentorship, everything can help you grow you, yourself, and your business. Lastly, the team. Now, the truth is you can't do everything on your own. You need a group of individuals that are going to support you and are going to share the task load. So for me, it was competitions and preparing for them that enabled me to realize what competencies I need in my team to create a team of the right individuals that will get the job done, and to use the connections from these competitions to connect with additional mentors that could help me, that would advise me to further grow the business. And in my case, I really owe it to my initial team members that really trusted me to not only get the job done, but to guide them in a way that we can develop the idea that we proposed. And they also help you realize that it is your duty to learn to trust and delegate, which is quite vital as someone who wants to manage the team workflow, but also it is your responsibility to reward their trust as they have trusted you over time. Lastly, I would say that it is hard and it's meant to be difficult. So don't be disheartened if you do go through some difficult times. And the way I would say all of these are connected is that in my own journey, I realized that initially I needed some capital to do experimentation, to build the equipment as well as buy the data sets. And at that time, I took programming contract work to earn some side cash whilst I was working on the PhD and the venture itself. So at that time, my parents would be saying, don't risk it, don't do it, going against all of it. But in reality, it's your hunger that keeps you pushing, and your supervisor and your team, that hope that will keep you going. So when you're about to risk everything, I would say don't freeze in this fear, which can become overbearing from what people will feel. You'll realize that when that happens, you'll show your talent, your commitment, which you seem to forget, but that is what will drive you, and that is what will keep you pushing. So when that happens, just show your talent and your commitment, and you'll be able to fight fear fearlessly. So lastly, you don't have to do it alone. There's many services out there within Imperial and from your own team that you can find, or within the school itself. And if you ever need help or want to discuss further, feel free to get in touch. Thank you very much for listening.
Wonderful, Sam. Thank you. And I can only concur with your feeling that the hunger drives you on. But as innovators, we're different people. And when there's an award every year called the National Innovator Award for within the health service, and our team was appointed. And I will never forget the first lecture. The innovator, who's done loads of innovations, said, "We are the most difficult people in the health service. We are like racehorses, and the key is nobody can actually contain us because we're always running." And so you will come against innovators are in the minority. And remember, you are in the minority because most people don't like change, like the status quo, and don't want you to change within their orbit. So there's always a lot of difficulties and political challenges moving as an innovator within your own slipstream, but something within us burns within us to keep going. And I urge you to keep going. And I urge you, there are a lot of names on here, and I urge you to make contact with one another, because it's the peer groups that give you so much support and so many ideas. And then you don't feel like you're so different to everybody else. It's you get a group of innovators that they become your norm. So thank you, Sam. And now we go on to Saira, who has an innovation. She's a founder and another innovator in mental health. And this couldn't be more pertinent than in today's world of COVID. We've all seen the mental health of our parents who are isolated, lonely. Mental health is now atop of many agendas. And so I hand over to Saira as she tells you more about her innovation.
Thank you, Julia. I'll just share my slides as well. Hopefully this will work.
There are no questions, so if you want to ask any questions, please do type them into the chat box and we'll answer them after the talks.
Just seem to be sharing. Can you see it, Nikita?
Yeah, I can see
Yes.
it. If you just do the slideshow button at the bottom.
I can't actually see my own slides. Oh, here we go.
Yeah, that's it.
Perfect. So my name is Saira Ghafur. I'm the lead for digital health at the Institute of Global Health Innovation at the college. I'm also a respiratory physician and I'm a consultant at St Mary's Hospital. And I'm the co-founder of Psyma, which is a mental health technology, and of Prova Health as well, which looks at evidence generation in digital health. So just to kind of set the scene a bit, over the past couple of months, we've all seen the chaos that the pandemic has caused across the world. And really, this has been one of the biggest catalysts for digital health innovations. And when we talk about things coming onto the market and how difficult it is to enter any healthcare system, let alone the NHS, we've seen that certainly the fact that COVID has come and we need to provide healthcare to people, the most accessible form has been digital over the past couple of months. Certainly the year-on-year analysis has been jumping over the past couple of years, and now we've seen a significant number of health and wellness apps on the market at this point in time. We're also seeing financial projections that the size of the market will grow from, at the moment, it's sitting at around 6 billion over to 56 billion in 2025. And one of the things that I truly believe is that digital transformation, anything that we do, must focus on the patient and healthcare professionals who are using it first and foremost. And then other things that we need to consider are regulation, reimbursement, and ethical considerations, which are huge, especially privacy and security as well. So this is with my college hat on, and now in the talk that I'll give over the next couple of minutes is to talk about my experiences in co-founding Psyma, which is our app, and also the lessons I've learned along the way as well. So this is Psyma. It's mental health technologies. So it's essentially we deliver online mental health therapy. And the reason we do that is to make therapy accessible, and that is the kind of raison d'etre for its existence. So in terms of why we did this, so myself, my co-founder is actually my sister, and she's a subject matter expert. She is a clinical psychologist herself. And as I said, I come from an NHS background as well, and I'm a respiratory physician, and we both brought our skill set to the table because, we talked many times over the kind of frustrations in terms of access to mental health therapy for our patients. From her perspective, she found that a lot of people missed their appointments because they weren't able to actually physically get to a face-to-face appointment. People with mental health problems also didn't want to kind of come to their face-to-face appointments as well. And the kind of attendance rate was almost below 50%. And she felt that actually video therapy would be a perfect solution for this. For my practice as a respiratory physician, one of the huge things that I saw is that we had people coming to clinic over and over again who were super breathless. It was a huge struggle to come to anything. And literally a lot of the time I wasn't changing their healthcare in anywhere in terms of, prescribing new medication or anything. And a lot of the burden of their disease was actually from a mental health perspective. But if you think about it, if somebody can barely walk 5 steps without getting breathless, what is the reason? How can we send them to more appointments and over medicalize their lives when it takes almost, half a day out to go to anything? And essentially, one of the other big things was waiting lists to actually meet any demand in the NHS are huge. And we're looking at 18 months in terms of people trying to get appointments for psychological therapies. So these were two of the big issues that were really driving why we felt that this would be such, such an important initiative to kind of bring to both the NHS, but also people paying out of pocket as well. So the initial couple of years, we started in 2017. So I think perhaps we were very naive, thinking that once we launched our app on the App Store, that it'd be amazing and we'd have lots of people coming and joining the service. And initially our strategy was business to consumer, and then we very much changed that to a business to business strategy. And we saw kind of incremental growth over the past couple of years, but really COVID-19 has accelerated the provision of healthcare online, and this has been across the board, both in terms of physical healthcare, but also mental healthcare as well. And we've seen a significant amount of investment in terms of mental health and wellness apps as well over the past couple of months. And I think this will just continue to increase over the next couple of years as we see that mental health is going to be one of the biggest fallouts from this pandemic. And we know already that mental health problems are also one of the biggest causes of disability worldwide, and the number of and the kind of impact that has on the economy as well and people's lives is absolutely devastating. So in terms of what we've done over the past couple of years, after we launched, our app's actually won an award for being the Health and Fitness App of the Year in 2017. One of our kind of USP bits is that we're actually, it's been founded by specialist clinicians in the NHS. As Julie had mentioned earlier, it's very, very difficult to kind of get into any health system, and to gain traction as well is very difficult. So one of our early achievements was to partner with the NHS. We've actually been revenue generating from fairly early on, which has been great. And in terms of funding everything, this has been, we've essentially bootstrapped it to date. As I said, we're commercially viable at this point in time, and we're very soon going to go out for one of our first funding rounds to grow the business. So in terms of what have I learned along the way and what are the top tips for anyone coming into this space, and the first thing is why you? And I think Julia and Sam both alluded to this, and just listening to their stories as well, it's very, very clear that they both had a drive from personal experiences as to why this has actually been, this has spurred them on to do this. And I think this is, super important as to why you're actually doing it is, what connects you to the kind of end product that you have, and what's your story, because actually people want to hear that and people want to understand what drives you to really kind of push that forward. The next thing is how do you frame the problem clearly? What is it that you're trying to solve? And we hear some brilliant ideas are out there in terms of, here's X solution, this would be great for, whatever problem that there is out there. But essentially, I think you need to go back to basics. At the end of the day, if this is not solving a problem for a patient, or if it's not solving any kind of pain point in their patient journey, or for a healthcare professional, if that's who it's aimed at, then actually the traction that it will have in terms of longevity is going to be very difficult. So that's what you really need to understand the problem and make sure it's actually the technology that you have is actually going to solve a pain point and make someone's life better. Then understand the cost of the problem. What is it that, if this technology did not exist, what is it that in terms of what the problem is going to cost both the individual patient, the health system, the wider economy, and actually what is it that if you solve that problem, what would improve, what would how would these outcomes improve as well? And one of the big things that we look at is effectiveness of any solution. And this is, again, one of the key things that we're working on at the Institute of Global Health, is evidence generation for digital health solutions. So as I said, over the pandemic, we've seen a dearth of new solutions coming into the market, but actually how effective are they really? And what is the evidence base behind them? So I think this is such a key thing for any innovator out there is, yes, there's brilliant ideas out there, but how are you measuring the effectiveness of any given solution? Is it both from the user experience side, but also in terms of healthcare what are you measuring in terms of outcome. And this is where data is crucial to make sure that you're collecting it from day one to show that it's effective. So it's one of those things that you go to any healthcare system, they want to know, how does it work? How effective is it? Is it going to make patients better? And if you don't have that data, again, it's going to be very difficult to enter any given market. And then on to the value proposition. What is it? So when you go for investment, what is it in terms of the investor? What are they going to gain from it? Yes, it's great that we're going to improve outcomes and a patient's life or a healthcare professional's work life. But what is it? What's in there in terms of, again, longevity on the market? If someone's investing in your company, what is it in it for them? How are you going to project your growth? How are they going to make money? And how do they see the viability of any given product over the next couple of years? And essentially, what is the exit strategy once you've kind of made it, you know, the #1 app or whatever else that you want to do with it? What is it that your long-term game is, and for them to be able to understand that as well. And I think just one of the big points that Sam made was about time management. I think it was absolutely brilliant listening to his insights, and actually, you know, bringing all of your different skill sets that you're learning, both from, you know, academic studies, but also lived experience, and bring all of that together to create an innovation that would essentially help people better their lives. And actually, in terms of helping other people, again, very, very open to you know, looking at people's ideas. If they've got anything they want to bring forward at the Institute, we're always very, very happy to help with that. So I'll stop sharing my screen.
Right, thank you, Saira. Thank you very much. So, two wonderful innovations that you've heard about that actually impact and change healthcare, but there are so many other thoughts, and we've seen that people have brought thoughts from beginnings, middles, and almost end and want to launch it. No part of this pathway is too early or too late. If you want help, I've just put Nikita's email address there. So if you want help, or at least that's one way of starting it, and then we can talk about it and find the best help for you. If you have any questions, if you would just drop them in the chat box and we can see who's best placed to answer them. Have we put you all off? Well, this prize, here we have a question. Do you have any tips for people wishing to open up their innovations to international markets? I personally, we haven't gone to the international market, but we, as part of the National Innovator Fellowship, there were a number of people who did and have very successfully taken their innovations that started in this country and have been taken to international markets. So again, if you send your details in, I will be very happy to put you in contact with people who have successfully done this, and then you can have a one-to-one with them. One did it through Boots, another person, she did hers urine analysis, and she's taken it very successfully to America and to Israel. So we can very much help you, put you in contact with people who have done this successfully.
Can I add to that?
Yeah, of course, please.
I just, yeah, I wanted to say it makes sense to also chase up international markets, because sometimes some ideas are better suited based on the market needs, and some markets are better suited for that than others. So in the case of Third Eye, since we're doing organ failure prediction, we realize different markets want different outcomes from our algorithms. So the way we tailor that is we literally contact in the initial stage the market, the people within the market itself, who are the buyers. And that is the best way to understand what the market's needs are, and then to tailor your solution as well as your strategy of how you get into the market accordingly. So the first tip I would be contact the people who are actively within the market, the users, so that you really understand what their problem cases are and how to tailor your solution for that market.
And I would agree with that. I think there are many markets that are much more ready to take on new innovations from abroad. This country is probably not one of the great innovators, but not implementers. Saira, have you gone abroad?
We've not gone abroad yet, but certainly I think very much understanding the technology and where it would potentially land. So in terms of expansion, our next step would be, if we went international, would be Europe, Middle East and Asia. I don't think at this point in time that we would enter the US as a market for this type of thing. There's other stronger competitors there, and just with the fact how you can practice from state to state, I think it'd be much easier to do it in more in kind of what I'd said earlier in EMEA, but also kind of focus on Anglophile countries as well.
Thank you. Another question. Thank you. Another one, if that's okay. Yes, of course. Health apps are a rapidly growing area with thousands and thousands available. How do you stand out in this already saturated market? Sam, would you like to start that?
I think there are two questions, right?
Yes.
So
the key is that there's so many health apps, and well, there's so many apps. How do you manage to stand out?
So there are four key processes that I use to define how you would go into the market, which gives you what is known as USP, the unique selling point, which differentiates you from the competitors. And that is what enables you to actually be successful even in a saturated market. So the first is what problem are you actually trying to solve? Right. So the app can be in many different domains. So let's say let's take a fitness app, right? That is trying to regulate your diet in particular. So that already is actually very narrow field. So you're focusing on the diet on that front. In that, the first question is, what are the competitors and what are they exactly doing, and to which customer are they focusing on? If you can delineate these three keys, then you can understand which market to chase, and therefore how to tailor your app specific to that particular population that you want to go after. And then the second point being the technology itself. What is it that you do that is different to what other apps are doing? Do you include a specific type of prediction mechanism like machine learning, or do you have some other proprietary technology that you're introducing? That is the level of innovation you're playing at. That is your unique selling point. That is what will tell other investors and your users why you should use your app. Third is the value you bring. What value does your proprietary technology actually bring to the business itself? You can create all these sorts of innovation, but if they don't actually improve upon what's already out there or provide some additional value, no one's going to join on and no investor will invest. So what value do you bring in addition to understanding your market as well as your technology? And the fourth being is simply your strategy of gaining users. How do you actually gain customers? So that comes more into the side of your marketing as well as your launch design, because at the end of the day, you can create an app, but if you can't hook users on and bring recurring users, it's a dead app to water. So those are the four key components that you would take.
Very good. And the question before, maybe Saira can help us with, how did you know where to start and when wanting to receive investments? Did you enter certain platforms to attract your investors?
So to date, we have actually bootstrapped, so we've essentially funded everything ourselves. So put a lot of money.
Oh, wow.
An investment in ourselves, so it better work. But now we've come to a point where, you know, we've made it as good as we can. We're seeing traction, we're seeing revenue, but really to take it to the next level, we need funding. So this is our kind of first funding round, external funding round that we're going for. And essentially we were prompted by several factors that we have kind of reached that stage. We need more people on board. We need to bring our technology in-house. There's lots of factors there that have really kind of pushed us to do so. But I think in terms of kind of looking for investors, so we've also got a team of advisors on board as well. And I think a lot of it is through various different networks. I think it's really crucial that as you're kind of developing the business, you're developing your networks as well, so you know where to go for investment. And certainly there's you know, various forums out there for angel investors. Look at different venture capital companies as well if you're at that stage as well. But also looking at your advisory team as well, and that's where that becomes really important. I think Sam had mentioned going to your PhD supervisors or any other connections that you might have, and it's pulling on those connections. But certainly it's kind of using social media as well, so tweet about what you're doing, use LinkedIn, and actually a lot of the kind of potential investors that we have for this round have actually reached out to us through various LinkedIn posts. We're kind of taking the opportunity of like the kind of people want to invest in mental health at this point in time, and they're looking for an opportunity in which to invest. So kind of make sure you use social media as a tool to gain that as well.
Thank you. I don't know if any of our viewers have any further ways, but do share them if you do. I would say from our point of view, we got grants within the health service. We first had legacy donations from patients, and then we had grants from the teaching, the National Teaching and Training Boards, and then we got commissioned by one clinical commissioning group, and then by two, and then by three, and then by four. And so we grew organically. We don't have any private funding. It's all NHS, and our service belongs to the NHS. So it's not only, I mean, obviously most innovators run their own businesses. And so if anybody can offer any other help, if you need help, again, let us know, and we will put you in touch with the right person. I think we have one more question, which I think is a very interesting question, asking us in 10 years' time. So we'll ask our young innovators, Sam and Saira, in 10 years' time, what medium do you think you'll be acting in? And what would your approach be, not from the non-human, i.e. the technology side? And then the questioner asks, the reason for asking this is because technology develops so fast that it almost feels like it's going to take over completely in the next few years' time. Do you have any comments?
Yeah, so we have, so I totally agree with the fact that technology grows rapidly. So in the field of software and AI, we know for a fact we'll be consistently innovating. It's the only way to stay ahead of other competitors. But the question is how you innovate is what puts us in different mediums in the future. So though right now we're starting with predicting organ failure in the ICU, but our end goal is defined by our long-term vision, which is trying to create or simulate a patient's physiological condition, right? So if we can create a patient simulation, then we can simulate what are the possible futures that patient can hold. And if we're looking at that over that large question, which we're trying to solve, then the areas that we can delve into actually increase, which goes beyond the ICU. So the way I would deal with this, I guess, paradigm is not to be fixated on the solution, but to be fixated on the problem you're trying to solve. That way, the solution becomes nimble, and it doesn't matter which side of solution you go into, the problem still stays the same. And that's why we're open to whatever field we go into in the future, whether this is solved by AI or some other different medium. But the problem is what we're connected to, essentially.
Interesting. I would agree with that. Stick with the problem, because the problems are not going to go away. In particularly in my area of expertise, everybody's going to die. So how you do it and how you look after these people, that problem remains that problem. How we deal with it will change over time. And I do think it'll change into all sorts of different ways of moving in. But if we stick to what the problem is, it's a good way of keeping your anchor. Saira, any comments from you?
I couldn't agree more on that point. And I think you have to constantly innovate. As soon as you've kind of launched one product, what you need to do is to think, what's the next one, and actually how are you going to, continually stay ahead of the curve. And one of the things is, what new technologies can you bring on board? How can you use your data that you're collecting as well to improve the experience for patients, to improve the outcomes, what are you learning from that, and what's it telling you, and how can that help you develop any additional technologies as well. And I think that's the problem, or that's the good thing about innovation, is that it spurs you to be continually innovative if you are to have any type of longevity on any market.
Right, well, I think that's a very good place to end, where we are saying once you start innovating, it's like a drug. You just want to keep going. So if we can help you through that process, contact any one of us and we'd be delighted to help. And I hope you will all put in an application, which the judges will choose by January, and you will be heard. And I hope one of you attending this evening may be presenting for next year's fellows. So thank you very much for giving us your time, and whatever your innovations or of innovations, we wish you loads of luck and great courage. Take care.